Good morning. I am Bharathi, completed M.Sc Nursing in Childhood Nursing. I am working in the VIVEKANANDHA College of Nursing. Today we are going to see about the class topic is newborn reflex. So newborn reflex, there are the many types of that. Today we discuss about only the 12 types of reflexes only. So the first one is the blinking reflex. So blinking reflex means, so for that when we are giving any objects towards the baby's eyes, the baby start to blinking their eyes. It indicates that blinking reflex is present. The next one is pupillary reactions. So when you are giving any pen torch or any objects near to the baby's eyes, the baby start to react, the baby pupils will be start to react. Okay, so it's indicating the pupillary reactions also present in the over the baby. The next one is doll's eye reflex. Doll's eye reflex means, so when we are baby, suddenly we are changing the position of the baby heads, either the right or left side, the baby start to react. It will be suddenly the baby eyeball cannot able to move towards the which side we are changing the head of the position of the baby. So it's a remain lag in the same remaining the same position of the eyeballs will be lag in the same 2-3 minutes of same position only. It's indicating the doll's eye. It looks like the doll's eye, the same position of the eyes. Okay, it's what's it's called as a doll's eye reflex is present. The next one, sneezing reflex. For sneezing reflex, we take that any, I have taken any cotton. So in this, we scroll, looks like the neck, show up like that. So we will giving that like this position, we need to take the cotton, and we are near to the, we are taking the cotton and near to the baby's nose, the baby start to sneeze, right? As how we also do like this only. Like, so it will be the presence of indicating the sneezing reflex. The next one is move on to the glabellar reflex. Glabellar reflex means, so we need to be give the point over the midpoint of the eyebrow and the nose of the roof of the nose. Okay, so when giving the pressure to the pointing to the midpoint of the pressure over the here the eyebrow, the baby start to blink their eyes. So it's indicating the glabellar reflex is present. Okay, next one is a rooting reflex. Rooting reflex means we have to give the one stroke to the baby. So how it looks means, so while giving the stroke from the ear to the mouth of the baby, they like this. Okay, we are giving the one stroke to the mouth to the near to the baby. So the baby will start to open their mouth. The baby think that is something it's giving to my mouth. Okay, so the baby start to open their mouth. It's indicating the rooting reflex is present to the baby. The next one is sucking reflex. Sucking, when the baby is holding that and near to the hold the baby near to the nipples, the baby start to open their mouth. So it will be the start to suck that. Another than, so if we are giving that any finger or objects to the baby's mouth, the baby start to suck their mouth. Okay, so it indicating the sucking reflex is present. The next one is grasp reflex. Grasping reflex is two types. That is, one is the palmar grasp, next one is the plantar grasp. Palmar grasp means, so when you are giving any objects to the baby, so baby starts to hold that object, hold the fingers to the tight and the fist, hold the fist and the fingers tight to the towards that object. So indicating the presence of palmar grasp reflex. So as same like that plantar grasp. When you are giving the objects to the toe of the babies, the baby start to hold the tight the toes, all the fingers, toes fingers of the fingers. So it's indicating the plantar grasp reflex is present. Okay, so then next will be more to the Babinski reflex. Babinski reflex means, see the baby with leg will be like this position. We need to be place the baby in the supine position, and we giving the babies to the one stroke from the here circular. Okay, like this. I hope to see that. So when you are giving the slight reaction to the babies, okay, so any objects you can take. So being the one stroke to from heel to the upper palm of the toe. So you will giving the stroke, the baby to a great toe will be extend and remain all the toes will be the flexions. So it indicating the Babinski reflex is present. Okay, the next one is the Moro reflex. Moro reflex means, so we need to take the baby, so like that supine position, we giving the support to the one hand support to the head and back of the baby, and another hand is back of the baby. Okay, one hand is head and supine portion. Okay. So then here we will giving the sudden withdraw of the one hand, head portion of the hand to the withdraw of the head. So suddenly lag to the baby start to giving that extension of their head. Okay, that hand and legs. So it's indicating that it is like this will be the baby will start to extension. Okay, it's indicating that Moro reflex is present. Okay. Then next is the startle reflex, as same like that. So it's a say baby will be placing the baby in supine position. Okay. So now we are giving the any sudden loud noise. Okay, giving the sudden loud noise to the near to the baby start to starting. Okay, like this reflexes will be start to the reflexes. It shows that starting reflexes is present. Okay. Then next is the tonic reflex. Tonic reflex means, so when your baby looking as when you are holding the baby, so in the like same like that, like it's a supine position only. Then while I turn the baby into the either towards the left side or right side. So now we are turning the baby in the left side. The baby's opposite side of the direction of the head and leg will be the flexion, and then same side of the head and leg will be arms and leg will be the extensions. Okay. So this indicating that tonic neck reflex. Okay. Then next is the parachute reflex. Parachute reflex means we need to be take the baby and giving the suddenly we are giving the support to the baby in that abdomen position, and suddenly we are giving the drawn to the baby in the downside. So what happened, the baby will start to extension of the head and arms and legs. So looks like the parachute. Okay, so flying, parachute flying, which is indicating that parachute reflex is present. Okay, then next one is the stepping or dancing reflex. Mean we need to hold the baby in that giving the support to the axilla. So while the baby placing the baby in the floor of the baby or the floor, then while placing the baby in the floor, the baby start to looks like that there is a start to walk or start to standing like that, giving the steps forward towards the next steps. So like what we think that is looks like that's like a dancing. Okay, so it's also called as a dancing reflex or stepping reflex. Okay. Okay, this is all about that some few of the reflexes we have seen today. This is what about the newborn reflexes class. Okay, thank you all.